Hey everybody! First I want to thank all of you for participating in precepting our paramedic students. This presentation is just going to cover a quick clinical orientation to let you know what our paramedic students can do, what the purposes of them being there, and just to kind of give you some familiarity of what they are actually doing and what they should be doing at the clinical site. Our students spend a significant amount of time in the hospital clinical setting. They're going to various departments within the hospital: emergency department, labor and delivery, intensive care units, respiratory department, operating rooms, and various hours in pediatrics, such as pediatric clinics, the PICU, and so on. As part of all that legality things that we have to do, the college carries a $1 million liability insurance. This is simply for malpractice circumstances only. This isn't their health insurance or workers' compensation or anything of that. So in the event that they do become injured on a site, they slip, they trip, they fall, that's still the responsibility of their own personal healthcare costs. So all of our students are familiar with this, and they're always told during orientation that it is not required, but it's very strongly urged that you carry your own personal health insurance, whether that's through you, from your employer, or from mom and dad. Before the students are ever released to go to clinical, they've completed all those requirements by the hospital's clinical coordinators: a criminal background check, vaccinations and immunizations, a clean drug screening, a physical, and they've all completed those site-specific trainings and orientations. The students are responsible for scheduling their shifts prior to showing up. They don't just show up unannounced. They're required to schedule the shifts generally within a 72-hour notice. Each of those departments they're scheduled for must have a clinical agreement. They can't go to just any department, and in those respective departments they must be precepted by at least an RN. Now let's talk about why the students are there. They're there for you to teach them. It's not a skill-driven clinical only. Yes, there are minimums of skills and interventions that our students have to do, but the big purpose of them being here is a learning environment. So now think about this. Have you ever complained about a paramedic? Has a paramedic ever brought you a patient and you did a complete face palm, like, why did they not do this, or why did they do that? So think about that with paying that forward. If you or everyone who's complained on a paramedic, make sure you're going to be teaching the future of EMS, be teaching those future paramedics. Share your knowledge and share your wealth. Maybe not so much your wealth, but at least just your knowledge. On the topic of teaching them, they need to know all those basic ALS skills, including soft skills of how to communicate with the patient. Sometimes there's therapeutic communication aspects, how to approach patients, how to assess them, how to interact, how to communicate, how to be part of the team, all those kind of soft skills as well. And cover with them diseases, pathophysiology, medications, A&P, and quiz them. So if you have a patient that's got a disease, quiz them. Hey, what do you think is going on? Explain this disease process to me. What kind of medication should we give? What's the dose of that medication? What's the side effects? How fast do we give the medication? Quiz them on everything. Put them on the spot. It's there as a learning environment. And don't be afraid to give feedback and critique them. If you see them not scrubbing the hub before they give a medication, critique them on that. If they have bad IV skills, critique them on that. It's there as a learning experience, not just as a friendly social experiment. Okay, so now here is a breakdown. I like to present all this to our clinical affiliates just so they know what all our students are doing. Our students are inherently busy with their work and their classes and everything, so this breaks down in their semesters of what hours they're actually doing. So you can see here total throughout the entire program, our students are doing over 400 hours of clinical and field, I'm sorry. So, but that's a minimum. A lot of our students go above and beyond that because they still have to hit their minimum of skills and interventions. So if they're not getting enough assessments or IVs or medication administrations, or they're back out in the field or back scheduling more clinical. So at a minimum, our students are doing 430 clinical and field hours. So they're getting pretty well versed in everything that they're covering. And here is the clinical and field competency minimums that these students have to get. The very bottom of this doesn't relate to the clinical, just like to show it to give you a better idea that our students are doing 50 ALS calls on the ambulance. But all these age groups, the assessments by classification and by impressions, and those skills and interventions, those are all things that they have to, those are benchmarks they have to hit in the clinical setting and out in the field. As I said before, those shifts are scheduled ahead of time, and we use a vendor called FISDAP. And FISDAP, what it does is it provides a scheduling system to the students. They can go in and pick shifts that are available. So when a student picks a shift, it sends a report to the clinical coordinator that's designated to that respective hospital and department. Lets them know that, hey, on this date, John Smith will be here from 7 a.m. to 3 p.m. And so the students also use that to schedule, and that's what they submit all their patient information in. So that FISDAP system tracks all the patient data, tracks all their minimums and all the requirements that they're having to hit in the clinical and field setting. Now let's talk about what goes on when the student shows up. So when a student first gets with the preceptor, they're required to present this clinical shift debriefing form. This is a form the student and a preceptor will go over together. It's an informative form to kind of do a quick orientation of what the student can do, what they need to do, what the whole purpose is of them being there. So they'll present this form they go over, has a checklist of things to go down. So it goes over the requirements, the skills authorization that they're allowed to do, the medications they're allowed to give, the documentation and evaluation forms that they will use, and then the student is to discuss with the preceptor where they're currently in class, what the topics are they're covering, review with that preceptor any kind of specific requirements that they might need. Say if they're at the end of the program, they're short a couple trauma assessments or OB assessments, the students will know where they're at, so they're to relay to you where or what areas they really can focus on or they'll need to focus on. Also, they will develop a plan with you as a preceptor of how to participate in kind of the teamwork environment and what their roles will be. Once you go over that, you as a preceptor are to sign this and acknowledge this debriefing and orientation. Then other forms they're going to present is this skills authorization form. It gives a list of all the skills they cover, but they are not allowed to do any skills that are not signed off on. The only skills that they can do will have an instructor's signature beside it with a respective date. They'll also provide you a medication authorization form. Same thing. All the medications that they'll cover within a class, they're not allowed to administer any medication that's not on this sheet, such as, say, Dilaudid. And they can only administer the medications that have been signed off on in that authorization box. A record form that they'll use, this is just for them to use as notes of the assessments that they've done and all the interventions and everything, but also you as a preceptor are expected to sign each one of these forms just so we can maintain integrity of what those students are actually doing. And finally, wrapping up the shift, here's a clinical shift evaluation form. Please be 100% honest in all the feedback in this. Each category is presented or to be given a 1 to 5 Likert scale rating. Anything less than a 3, please put those comments in that box at the bottom. And again, as a preceptor, sign these forms and be sure that you've got the right time in and time out, and sign that as well. So a few pearls from this training is big one. You need to teach the students. Teach them how to do assessments, how to perform skills, provide them a gateway to knowing the knowledge of what they need to know, and make those students earn it. If they need to do trauma assessments, make sure they're in or doing an assessment on a trauma patient. It's not just exposures and encounters, it's actually hands-on. This is what they need to do to be taking care of these patients before they get to the hospital. The students ultimately are a representative of the EMS profession and of our institution. Make sure they uphold that professional standard. If they are unprofessional, send them home. If they show up and they've got bad body odor, they're not wearing the appropriate uniform, they didn't come with any paperwork, they're not being attentive, they're on their phones, if they're not being a professional person, if you wouldn't want them to be a coworker of yours or an employee of that hospital in the manner they act, send them home. And of course, if you do that, just go ahead and notify. So you have all the right to refuse to let them be there for that day if they're not prepared or if they're just being unprofessional, and let us know. Again, it's all a learning experience, so life's about choices sometimes. And ultimately, just want to thank all of you for participating in this training. Here's our contact information. And at the bottom, you'll see the little picture there. That is at the bottom of all the paperwork that the students have. If you need to contact us, that is the best way to do so. My name is Ben Tacey, as a program coordinator. I'm probably the easiest to get a hold of. So with an email, generally if I'm awake, I'll answer that. The phone number, that is my office phone number, and it's actually a cloud-based system, so if you need to contact that, it will also come into my cell phone, and you can also text that number. So you can email me, text me, call me if you need something. Of course, if it's an urgency thing, if you send a student home, please try to contact all of those until you reach somebody. But if not, send a voicemail or a text with a message, send an email with a message, say, hey, we had an issue, sent this student home. Thank you all again, and we look forward to working with you.